Jeffrey, how are you?
Right, well, so got it this time at 12, no less.
Okay, good afternoon, everyone, and thank you for joining us and coming back for this next important session. We're excited to have this group back by popular demand. They were with us a couple of weeks ago talking about the very important work of getting more New Mexicans signed up for affordable health care. And so we are really happy that we could provide them another chance to talk about this and to get the word out to New Mexicans about what they can do to get signed up. So I am going to turn things over to Veronica Arzate and Jeffrey Bustamante, and I think Ernie C. DeBaca is joining us here in a little bit. And then we've got Maureen Manning coming online. So I will get off the screen so we can make room for more important Be Well New Mexico presenters. And I will turn it over to Veronica.
Yes, so good afternoon, everyone. Thank you so much, Kathy, for inviting us to host another session with the New Mexico Virtual Roundhouse. We're very excited to bring very timely, very important information to all the different communities in our state in regards to access to healthcare, how can we reach out for free assistance, and what other resources are available to us as consumers here in our state when it comes to health insurance, financial assistance, the free resources, and all that good conversation. So my name is Veronica Arzate. I work with the Hispanic Chamber, and I am the project director for the outreach and education project that was awarded to the Hispanic Chamber. So I am very pleased to welcome this afternoon our CEO, Ernie C. DeBaca. I'll let him make his introductions, and then I'll introduce to you also our CEO from BWLM and our Director of Communications. But Ernie, welcome.
Oh, thank you. Thank you so much, Veronica. It's great to be back on this deal. The last time I wasn't wearing a little thing for my arm here. I have had rotator cuff surgery since the last time, so I'm here, and I'm grateful to be part of the BWLM team here today to talk about what's important in New Mexico, and that's getting health care for all New Mexicans and through BWLM. And with that, I'll send back to you, Veronica.
Yes, thank you. So as part of our panelists this afternoon for this lunch session at the Roundhouse of New Mexico, we have Jeffrey Bustamante. He's the director for BWLM. Good afternoon, Jeffrey.
Good afternoon. Good afternoon, everybody. As Veronica mentioned, I'm Jeffrey Bustamante here at BWLM and excited to talk to everybody today.
Thank you. And the Director of Communications for BWLM, Ms. Maureen Manning.
Thank you, everyone. We're really excited to be here today and definitely appreciate this opportunity.
Yes, excellent. So I want to, we have a set of questions prepared for and topics of conversation prepared for all of you this afternoon. And but before we get into what kind of resources we have available as consumers here in the community and throughout the state, I want to have a little recap about what is happening right now in regards to people being able to sign up for a health insurance plan, what happens right now in this next few months that we have available for those who perhaps were trying to get a health insurance plan during 2020 but didn't have an opportunity, or maybe now they're finding themselves that their health insurance from last year expires. So Jeffrey, can you tell us a little bit about that?
Yeah, absolutely. Thank you, Veronica. So right now we have an enrollment period going that is much like the open enrollment period you see in the fall. In the fall, it's that 45-day window from November 1st to December 15th. It's similar to that in that you can get connected to coverage without any special qualifying event. You can just reach out to BWLM and we'll see if we can get you on coverage with us or someone else. We have partnerships across the state to make sure you get covered no matter what. With that said, it started on February 15th, so it has since started since the last time we spoke. Very exciting about that. And it's running until May 15th. Now, there's a few really important differences to this enrollment period. First and foremost, we have an ever-expanding network of free local help, in large part, and huge thanks to the Chamber and all of their partners for that. But also, really, that individuals may qualify for coverage and may qualify for some assistance on that monthly payment or when they go to the doctor that they weren't aware of maybe last fall. So, and then really just on some of the other big differences is if you sign up today, you'll have coverage April 1st. If you sign up in April, you'll have coverage May 1st. This is different from that fall open enrollment where if you sign up, you get coverage January 1st no matter when you sign up. So we're really encouraging folks to get through the door, start talking to us, explore your options, explore what you may qualify for, and use that free help so that you can have coverage as soon as possible.
Yes, excellent. So don't delay. Go ahead and schedule a virtual appointment or call us on the phone and find out how you can go about it. And the sooner you enroll, the sooner your plan will get started. So, Ernie, can you tell us a little bit about how the Chamber is helping Be Well NM share the word and the information in regards to this opportunity for New Mexicans to get access to healthcare?
Absolutely. Thank you, Veronica. As the Albuquerque Hispano Chamber, we're in charge of outreach and education for this effort. And as Jeffrey mentioned, I don't think it's ever been done before when you had a special enrollment period that's lasting for 3 months. And so this is an unbelievable opportunity for those eligible New Mexicans that do not have health insurance to get on the website, Be Well NM website, and look at the different options that you might find. It's free to get on. There's a lot of free help on this stuff. And, the people above me, Jeffrey and Veronica and Maureen, they all know the plans extremely well. And the opportunities, I think right now during this period are better than maybe they've ever been before for people to get very low cost or no cost insurance. And there's no better thing that we can do for our families and for our relatives and for our friends is to make sure that everybody is insured. So we're in charge of education outreach. We have a great team here at the Chamber, Be Well NM. We've hired some folks that are really good at outreach, Hispanic outreach, Native American outreach, and small business outreach. But we also have a great sub-vendor team that is helping with advertising and marketing, K2MD, the Primary Care Association of New Mexico. They're part of the enrollers in the sisters group. We have research and polling, helping us with the polling and surveying. And we also have real-time solutions on the website. So we put together a really good team to really try to do the best we can this year. This is the best opportunity. And Jeffrey, Maureen, and Veronica, you guys will probably say this better than I. This is probably the best opportunity in the 8 years or so that Be Well NM has been in existence to get people enrolled and insured, especially during this special enrollment period.
You're on mute, Veronica.
I would not unmute.
Ernie, so that is so true. We have access to great resources, great opportunities. This hasn't happened before of having a open enrollment period right now or at the beginning of the year for this current year. But if people are not aware of those opportunities and they don't know how to access assistance or who to reach for guidance and information, then they're not going to take advantage of any of that. So it's up to us. Last Friday, the Hispanic Chamber hosted a community event, and that was, we know during this pandemic, everything has had to be virtual, whether it's webinars such as this one, Zoom calls, and creative alternatives. But we were able to host a community health day where following all the public health orders of social distancing, everybody was wearing masks. Small business had the opportunity to enroll to participate in that event, and it was Friday all day from 8:30 in the morning until 1:30 in the afternoon. And people who were small business owners were able to drive in the areas surrounding the Hispanic Chamber and be able to, BWLM had hosted a booth with information. We had our staff out there giving brochures and answering questions from people in their vehicles, like, how can I get in touch with somebody that can help me guide or give me information for my employees in my small business. So it was very, very good to be able to just start seeing a little more of that interaction. And we're hoping as the good weather comes to us, we're able to host more of this curbside events, or perhaps you're going to start seeing us, the team, at a parking lot in one of the partner shops or businesses, because again, we want to make sure that everybody's aware of what resources are available. But with that said, I want to invite Maureen. Maureen, can you tell us a little bit about why it's so important that people know what is the benefit of calling or seeking information through a certified enrollment counselor?
Yeah, great question, Veronica. And just to kind of piggyback off, I mean, we have outreach and we have a large state to cover. But outside of the education that BWLM is providing across the state and the understanding, the other component is the resources to the people that are in this state to help New Mexicans sign up for coverage. So when you use a certified agent, broker, and or enrollment counselor, and they're only listed on our website at bwlm.com, and make sure you go to our official website, those particular people who are listed as a resource know and understand New Mexico. They also know and understand the insurance carriers that are offered under this program. And they understand the network of doctors, and they understand the terminology that's used. And many of us live this every day and been in this overall business of healthcare and health insurance for over 28 years. So to me, it's everything I know. But most people are really focused on their jobs, their roles, their profession. And this is not one of those things that you do every day, but it's definitely an important aspect of your comfort level to make sure that your family has security and coverage when you have those healthcare needs that arise or will be arising. As we just always say, as you just never know, and this year is just, this past year was definitely a strong statement to that. But the certified enrollment counselors and brokers, like I said, they understand everything. They understand the language. They will help you. They're not only there just to do that one-time application for you. They are a long-term partner to help you through any other questions that may come up later down the road related to your coverage, or if you feel like you need some assistance or clarity on a letter you received. You always want to, go to your insurance carriers or the people who sent you those letters. But if you're needing someone else to help you, those enrollment counselors and brokers are there, and they're representing you. So you can always reach back out to them. And want to make sure that you understand that it's not just a one-time thing, do my application and I won't hear from you today. It's building and bridging that relationship, because health insurance is a commitment. It's a comfort level. And sometimes it's a whole new area of understanding that most people go through until they get further into understanding what their insurance involves and provides. And plus, it's very comprehensive coverage. It's covering, preventative care. It's covering, mammograms. It's covering office visits. I mean, there's a lot of coverage to it that's very important right now, in laboratory services and so forth. So Thank you,
Yeah.
Veronica.
Yes, so as you are mentioning, I have had the opportunity to work with a certified BYNM broker for the past, I think this is going to be my third year working with the same person. And as you say, I like that relationship that has been built because I feel like they know my family and my circumstances because my initial, and I think this will be anybody, right? We all like to save money. We all like to get whatever seems to be the best deal available. So my inclination will be like, if I'm looking at different health plans available for my family and myself for 2021, I'm going to go and select the one that has the lowest monthly premium, right? Because that's the less expensive and I'm going to be saving money. Little do I know that because my children are still young and I need to be taking them to the doctor for office visits throughout the year, and maybe, like skateboarding or bicycling, they break a bone and all these things happen. I was not aware that the more office visits that I have, I'm going to be paying higher office costs. And at the end of the year, that plan that I thought was the least expensive is going to be much more expensive than if I had a certified enrollment counselor guide me and tell me, based on your circumstances, your family medical needs, this plan, it's a little more per month, but at the end of the year, it's going to save you a lot more money. And that's information that we don't know about it, right? So, Maureen, can you tell me how does enrollment broker or agent get certified? Or what are the requirements for them to be able to help people with the marketplace?
Yeah. Well, if you're certified agent or broker is also a licensed health insurance agent for the state of New Mexico. So there's some other training and education and definitely some courses and stuff that need to be passed to be not certified, but licensed. Then the next aspect is they have to pass some other training, additional training and insight into the marketplace coverages and how the premium assistance programs work and stuff. So they take these other courses that if they have an active license in the health insurance industry and they take these additional courses, then they are considered certified. Enrollment counselors are usually people who have worked in the medical field, might be in a clinic or a hospital, majority of them, and they take the certified courses as well, designed for their aspect of their role and in the marketplace, and that becomes certified as well. Yeah.
Thank you. And Jeffrey, can you tell us if I live in the southern part of the state, like do I need to make sure that the enrollment counselor lives close to my area, or how does that work?
You absolutely can. It's really up to you. We have free local help. We have someone who is located in the majority of our counties. Of all 33 counties, we have most of them covered. We can get somebody local to you, but we can also support you in a variety of ways. If you want to talk over the phone, we have a lot of folks, including staff. You can always call our 1-800 number to get connected there and handle it over the phone. If you want to do it by way of a virtual appointment, similar to like what you're seeing here, but maybe just two people and talk through the cameras and get it sorted out, go to bwellnm.com and click that link to set up that virtual appointment. But if you do need some assistance, and look, totally understand, everything in health is an incredibly intimate decision, from whether you're at your doctor or picking the best plan for you. And it just would really help to be able to sit down with somebody and figure out what's going to be best for your family. We are absolutely prepared in the safest way possible to make sure we're there for you and can get that assistance delivered to you. So you have options, and we have prioritized the New Mexican safety along with just everybody's safety to help, be responsive to this pandemic, but also answer any questions you may have. So again, we have that 1-800 number. We have local help that you can call them directly, and you can find that list on our website, bewellnm.com, virtual appointment, or you can also reach out and we can figure something out for potentially an in-person discussion as well.
Yes, excellent. I would like to share that number, and I will be asking the webinar organizers also to share the website and the phone number with everybody. The number is 1-833-862-3935, or the website bewellnm.com, and people can reach out, and then we will help them, guide them on making a virtual appointment. They're completely free of charge to the consumer. So why not take advantage of this resource, right? As we're listening, all this information can be very complex. There's a lot of things that we don't know. So take advantage of the expert help available. Jeffrey, also, what about if I speak Spanish and I understand English, but I don't feel as comfortable with the vocabulary for technical medical things? Can I find help?
You absolutely can. And that applies not just to anybody listening here today. I'm sure most of you have someone in your life who could really, it would help to have some of those questions answered. So push that information to them as well. But we do have Spanish speaking assistants across the board, from our enrollment counselors to our agents and brokers to staff as well. So again, just engage with those ways of contact that I just mentioned, and we can support you in either Spanish or English.
Yes, thank you. And then also one very important thing that we want to make sure that consumers become aware of is that here in the state, we have something, a lot of times, like what is preventing us from making that appointment or signing up for healthcare coverage is because we immediately start thinking about the costs, right? And right now, during this hard times, economic situations that every family is facing in our communities, we start thinking, hundreds of dollars a month. I just don't have that in my budget, so I'm not even going to look at it. Maybe next year things might be a little better, and I'll take a look then. But we want to make sure that people know there's help available, right? So can you tell us a little bit more about this, either Maureen or Jeffrey?
I'll get it started, and then I don't mind handing off to you, Maureen, and Maureen's really the wizard on this, but there is a lot more assistance available than a lot of New Mexicans realize. It's just true. We've talked to a lot of New Mexicans, and even as we look through our own data, people don't always realize what's out there and what they can obtain. And that's why you're hearing us emphasize that free local help so much today, because we have folks there who are ready to help find that plan that best fits your needs. And with 5 insurance carriers in every single county in the state, there is probably a plan that, from budget and the doctors that you may qualify for, or you're looking for rather, that will fit your family's needs. Now, some of that assistance and what that really looks like, I'll hand off to Maureen, but absolutely, you can find one that fits your needs.
Thank you. So what does it mean, financial assistance, Maureen?
Well, the financial assistance is also known as the advanced premium tax credits, which is more complicated in its own language. But what it really means is there's an assessment of some tax dollars that are applied to your premium when you go to apply, and the system tells you how much that is based on your income, your household size, and so forth. So there's a lot of New Mexicans across the state that can really still qualify for, a $10 a month premium, a $40 a month premium. And I don't want to set any particular dollar amount because everyone's household needs are different and incomes are different. But as Jeffrey stated, the most important thing is to take the time to make a call. Or what I also want to mention is there is some consumer assistant tools on our website too, that if you felt like you really didn't want to talk to somebody yet or anything, but you had access to the internet and go to our website, you can go to the consumer assistant tool, plug in some personal information, even just some information about where you feel you are in your health status. And it'll give you a general idea of what you would qualify for some of that premium assistance, and give you an idea of what that would look like for you, yourself, and or your family, whoever you're looking for coverage. But this is really a huge opportunity for New Mexicans, and my heart goes out to everyone who doesn't have insurance right now, to take the moment to call. You deserve this opportunity to seek some information to help you determine your option for coverages, and get that information out to you. That's what we are here. We're here for the New Mexico residents, to be here and supportive and educate. But it's something that's available through taxes. I recommend everyone who doesn't have insurance at this moment, or is going to be losing it in a few weeks or so, to just contact us and do that little bit of research with us, or go to our website and use those consumer assistant tools at your comfort. And we not only just support Spanish, which is very prominent for our state, but I want to let you know we have people who can support with Vietnamese, Dene, other languages that may impact you or your household. And the ultimate ask for this group is, please share this information with your colleagues, your friends, your neighbors. Help us get the message across the state. We all love New Mexico. We all love our New Mexican residents. We want to make sure we get this word out very far and wide across New Mexico. So that's my heart request to everybody, is to please help us in getting this information, and take the opportunity of this huge opportunity to enroll now. It is very unusual, and it's a huge opportunity for everybody to seek coverage who does not have coverage today.
Yes, that is correct. So in addition to being able to find people who speak Spanish, Vietnamese, Dene, we also have people that specialize in the Native American community, which is very large here in our state. And if you feel more comfortable talking to somebody that understands that Native American community, like you can request that, and we have that available. But also, I want to emphasize, Maureen, in a nutshell, basically the financial assistance, what it means to the consumer is, whatever your monthly premium is going to be, your monthly payment to have that coverage, you will be, depending on your family size and your income level, you will be receiving subsidies, and then that brings that monthly payment down, making it much more affordable than what we initially think about that it will be. But also, it is important to emphasize, only through the marketplace is where people can find those subsidies, correct?
That's absolutely correct. And it's also the only place where you can receive the additional funding to help offset some of those deductibles and copays and some of those other costs when you access care through the cost sharing programs too. So it is only through the marketplace and bewellnm.com to seek that extra support in those costs.
Yes, thank you. And just so we can have a image in our mind about how many New Mexicans do not have health insurance coverage, do you have a ballpark number that you can share with our viewers today?
Yeah, we believe right now we have roughly about 56,000 that would really get a low to no cost coverage available to them throughout New Mexico. But I believe, and Jeffrey, correct me if I'm wrong, but I believe altogether we probably still have about 200,000 across the state who just don't have insurance. So the other aspect of our services is, if we can get you on the marketplace, that's wonderful. But we also partner with Medicaid and the New Mexico Insurance Pool too, for the people that might fall into other coverages.
That's absolutely right.
Excellent.
Is that correct? Okay, I just want to make sure my numbers are right.
It's a bit over 200,000 uninsured New Mexicans, and what Maureen was saying earlier is about 56,000 qualify for us, for Be Well and M. About another 40 to 50,000 qualify for Medicaid, and then there's some other qualifications there. And what she emphasized at the end there is probably the most important part, that we've set up these partnerships. So if you qualify for Medicaid, we're going to get you sorted out and get you onto a plan there. And if you qualify for something else, we've worked with our partners that, we have our own boundaries set, but we can make sure to get you covered, period. That's the most important priority as part of our service to New Mexico.
Yes, wonderful. Thank you. And not to put on the spot our CEO, Ernie Sidebaca, but, like speaking of how important, not just because of the pandemic, but because you just never know. Can you tell us, what would it have been like if you didn't have health insurance coverage, Ernie?
Well, you could see, thank goodness I had some kind of coverage. It's important that we do because you just never know, which is a great statement. And, I think that's a really good point, Veronica. Another thing that I think we should touch base is everybody's probably heard that the stimulus package that's in front, I believe it's in the Senate now, probably has somewhere in the neighborhood of $1,400 for many New Mexicans would qualify for a $1,400 check or even greater size check. And what better use of that money than to make sure that you are protected, that your family's protected going forward. This is an unbelievable opportunity that never has happened before, where you have this special enrollment period that lasts for 90 days for coverage this year. The next enrollment period is not going to be until November, and that's going to happen that will be for coverage in 2022. But this is for 2021 coverage. So as Jeffrey said, if you sign up today, in April 1st, you will have coverage for your family. And so if you are, and Maureen said it well as well, we have to inform our friends, our neighbors, people that we know. We have all kinds of great advertising that's coming out on TV, in the radio, in various newspapers, social media. But many times the best kind of media or the best kind of advertising is word of mouth advertising. So if you're listening to this, really think about those that you know that probably aren't insured and how important it would be to protect their assets, protect their family, if they would be able to get really low cost to no cost coverage for their family, for themselves. Because you just never know when you're going to need it. I mean, it happens all the time. So, yeah, I think it's very important. Thanks, Veronica.
You're on mute again there, Veronica.
Yes, thank you, Jeffrey. So we want to reach out to all the people who are viewing this webinar because you are the trusted voices in your community. You know people, you have friends, family, the people that you work with. Help us share this important information because if they hear it from you, they're going to be much more open and receptive to say, oh, my school teacher or my representative is sharing this information, and I know that they are the source of good resources, good information. They're not going to be guiding me to things that are not beneficial to me as a constituent or as a community member. Help us make sure that they hear about this opportunity to be enrolled and to have access to that peace of mind, just in the event of anybody, but also to stay in charge of your health. It's always good to be going to the doctor, the yearly visit, get a checkup, just to prevent things from developing into something bigger when they're still early on. But I wanted to ask either Jeffrey or Maureen, like you were mentioning about, we have 5 different health insurance carriers in New Mexico. And what does that mean? Like, I know not a lot of states have the same kind of coverage. Why is that important?
Do you want to take that, Jeffrey, or would you like
Yeah. I'll tie to what other thing you said there, Veronica, because I think it's really important, and then we'll get to just how great New Mexico is doing here as far as our offerings. But you mentioned the you never know, and you never know what's going to come up. And I'll just share a personal story on this, that about a year and a half ago, I'm up in the foothills getting ready to go for a hike. And weirdest thing, I get a brain freeze, and yet my heart just starts hurting really bad. Turns out, A-okay, doctor explained it, figured out what all it was. But man, I was in the doctor's office as quickly as I could get in because of just, that fear, and that you never know. And the pandemic highlights this, and it really has, just how important it is to have coverage. But even as we go into our next steps beyond this, personally, we always are going through something, and from the very worrisome to the very great, like the birth of a child, make sure to have coverage just as that backstop. Because if I didn't have that, it would have been that much scarier. I didn't have to worry about my coverage. I just had to worry about my heart being okay. And I was, fortunate that it was. But if that wasn't the case, that would have made it that much worse. And I'll even kind of flip this, that we're fortunate here in New Mexico to have the option of multiple carriers, so you can find also the one that best fits your needs on our marketplace here, that we have in every single county, 5. Some of our neighboring states have 1. You might hear in the news some years that they don't even, there's worries about even having that. And I'll let Maureen kind of take over on just how big of impact that can have.
Yeah. Jeffrey, thank you for that. And, Veronica, we do have the 33 counties across the state. And as Jeffrey mentioned, it's very wonderful that the 5 insurance carriers that participate cover all 33 counties. And within those coverages, which are Ambetter, which is a division of Centene, Blue Cross Blue Shield, Molina, Friday's Health Plan, Molina Healthcare, and then True Health New Mexico. All these insurance carriers are supporting New Mexicans and offering these coverages, and really important to cover the 33 counties. So it makes it great for us, because then we don't have to have, we just know we are covering the whole state, which is really important. We appreciate the Office of Superintendent of Insurance guiding our carriers to do that. But the other aspect is, depending where you live within the state, depends on where you access care, and who are your network of providers and hospitals accessible to you. Some of those carriers, if you're on the border of New Mexico and Texas, some of those carriers have contracts with some providers in Texas that might be part of your network to choose from. So it's really important, once again, going back to one of your previous questions, is these certified enrollment counselors, brokers, and all that have access to really understanding what those networks are, know how to navigate websites to find that information out for you, so that when you do choose a plan, you find that right premium, you find the plan that is going to most meet your needs from a financial perspective as well. Then your next question is my doctor part of that, or where do I go to get care? And they help guide you through that, depending, where you're positioned within the state and where you want to access care. I know some people will drive from Roswell to come into Albuquerque to see a provider because there's connection to that provider, and that provider, they check to make sure they're part of their coverage, so that they continue with that care. So we're very fortunate in New Mexico to have such broad offerings of insurance carriers, but also to cover the 33 counties. And that's another good valid reason to use those local certified enrollment counselors and brokers.
Can I just reiterate what Jeffrey said? Because what Jeffrey, his story, how many times do you hear people that have gone through what Jeffrey went through and decided not to go see a doctor because they didn't have health insurance? So many times you hear during this pandemic, people didn't go see doctors because they were afraid of the pandemic and they just didn't go. And sometimes that scared them away, or they weren't allowed to go. But you take Jeffrey, what he just said, if he was a person that didn't have the health insurance and he thought, man, I have my heart is hurting, but if I go in there and they put me in the hospital, my family will never be able to pay for everything, and so they stick it out. And then, sometimes tragic things happen that way. I think it's really important to think about those that and those that you love and care for. It's very affordable under this special enrollment period, the no cost, low cost opportunities. When I heard that story of Jeffries, it just reminds me of how many times you hear something like that, it ends up being tragic. And it's really incumbent upon all of us to think about who we know that may not be covered and just say, hey, get on the Be Well NM website, bewellnm.com website, get on the right website and just check it out. Make sure you're protecting yourself so you're protecting your family. I think that was a heartfelt story, Jeffrey, that kind of brought it really to light.
Well, thank you. And I appreciate that. And really to it, we understand that there's New Mexicans right now who are balancing electric bill, groceries, and this, and figuring that out is as hard as it's been in a long time. That's why, we have that free logo help to just help at least understand what your options are. And even if, while we always say, pick it up, pick it up, pick it up, and we're big believers in that, at very least explore your options. Even if you need some time to kind of think through it and hey, pick up the phone today. And then that way, if you need the month of March to consider it for April or not, you have that time. So again, that's why you've heard us talk about it so much here today, but at least know your options.
And, I too want to just comment because as Ernie mentioned, appreciation of Jeffrey's story, a very important portion of the Affordable Care Act is, if you have a pre-existing condition, you can still get coverage. And I know we've said that earlier on and continue to share that message, but that's also a very important message that still needs to resonate, that, if for some reason, you did have a heart condition or diabetes, which we know is very common in certain things, you can still get coverage. None of that really, none of that comes into play on how your premiums or whether you're accepted, so it's get that part too.
Yes, and I wanted to mention that, and that's a little bit of what I was referring to when I said peace of mind, when you have health insurance coverage, we help you have that peace of mind for you and for your family members, because when you're not feeling well and you're at the doctor, you're stressed already about, what's happening with you, how's your health, what's going to be forthcoming. And the last thing you want to be worrying about as you're waiting for diagnosis or whatever is coming, you don't want to have to worry on top of all that to the stress of how much is this going to cost me? And where am I going to get the money to pay for all these treatments or all these checkups and everything that they're doing at the time? So is that peace of mind. But I also want to touch on what Maureen was saying, because when you are accessing a health plan through Be Well NM, through the health insurance marketplace, that means the coverage that you're going to be receiving is going to have the 10 essential, what is it called again? The 10
Health
essential.
benefits.
Yes.
Health benefits.
Yes. That sometimes maybe you're buying a plan someplace else and you didn't realize that those were not compliant with the 10 essential benefits. Can you tell us a little bit about that, Maureen?
Yeah, and Veronica, that is true. Some people are purchasing plans out there that are, let's say, limited or kind of have a scope down of coverage, or that the price looked really good and you bought it, but then it's like it's not really covering you when you go to the urgent care or ER or some of the other services you may be seeking care for. And then you find out, oh, this isn't the plan for me. This is not what I thought it was. And this is when, this is a time to approach Be Well NM and say, what's really out there? And these plans are very comprehensive to where they cover emergency room, they'll cover procedures, they'll cover mammograms and preventative care services, laboratory, prescriptions. Big area of need is medications, prescriptions. They cover behavioral health. We know behavioral health, especially right now, is more heightened than ever in our community. So it's really important to know there's some behavioral health care services as well under these policies and coverages. So they're very, very, very comprehensive. It's just finding the plan that works for you from a budget and a cost perspective, and providers and networks and what your needs are. So the qualified health plans, or the insurance carriers I mentioned earlier, are offering qualified health plans that cover the 10 essential benefits, but the 10 essential benefits are not all that they cover. It's just those are some of the core pieces that they need to cover, but they cover much more than that. You have to
Yes,
to a
excellent.
certified rep.
Yes, so just visit BWLM.com, the official health insurance marketplace for New Mexicans, and then you can rest assured that your plan and your coverage is going to be certified, and you don't have to be worrying about, like, am I not covered for everything? So again, we make it easy for you. Just send your family members, your employees, your friends that don't have health insurance, or that are about to lose their health insurance, to BWellNM.com, or 1-833-862-3935. And Jeffrey, if somebody already enrolled in November, December of last year for a 2021 health plan, and now, maybe they want to take a look at something different, do they still have an opportunity?
So they do. There's a few important things to remember as you consider this, though. So you can log in, you can look and see if another plan better fits your needs or what have you. But there's two important things I want to bring up when I say this. If you've already gone to the doctor this year and already started paying into that deductible, switching plans will reset it. So just consider how that might impact the rest of the year. And I'll just do a very quick example. Let's say you have a $2,000 deductible. You had a procedure, a rotator cuff surgery, perhaps, and you're already some into it. It may make sense, especially just for what the rest of the year's expenses are going to be, to stick with your plan. Or it may not. So just, again, evaluate what works best for you, because if you do switch plans, it's probably going to reset that maximum out of pocket that you see listed there. However, we are encouraging everybody on the exchange and everybody who qualifies for the exchange to just re-log in May. Now, there might be a reason for that we're watching with Congress. Congress is looking at some additional funding to help lower those premiums a bit more. But if you're already enrolled, to get that, you're almost certainly going to have to re-log in and just confirm a few things to make sure that you can get that lower premium this year. Otherwise, you get it at the end of the year. And while, that return being a bit larger is nice, I'm sure the extra, whatever it may be, and it might be, even $20, $30, $100 for somebody a month. I mean, get that now. So even if you signed up last fall, if you sign up in February, or you're signing up today, log back in May and just make sure. And also, we'll be talking through this as we get closer to it.
The other thing too to just keep in mind is the in-between jobs and in-between coverage. Still call us if you're needing coverage for just a 90-day window. This can still be that opportunity. And maybe you're on COBRA and your COBRA is going to be expiring. Definitely contact us. If you if that occurs for you in August or something, please make sure you call us, because you do have just a limited time to reach out to us if you do lose coverage. But for right now, this May 15th deadline is very, very important to take some action beforehand.
Yes, thank you. And I have been in those scenarios personally where I was in between jobs and COBRA was so expensive. It was just astronomical. And that's how I first got introduced to the marketplace, like realizing there were other options, and it was a much better and more accessible costs to have my family and myself enroll into a health insurance plan. And just quickly, for all the viewers out there who are joining us in this afternoon webinar, I want to let you know, like, whether you're an elected official, you're a community leader, please make sure that you reach out to us. We do have access to brochures. A lot of our brochures are available in bilingual form. So, and we have them also available virtually, like they're ready for you to, like, as simple as reaching out. We'll send you the PDF on an email, and then you are welcome to share that with your network, with your employees, with your constituents, or your friends and your family. We want to make sure, again, that this information reaches everybody in our state, whether you live in a rural community or whether you are here in the metro area. You're south or north or wherever in the state you are. We also want to make sure that we reach out to you, like, not just if you are of a certain age group, like 34 to 54, where you're having your family. We have a lot of those millennials and the young adults that are aging out of their parents' health plans at 26. So this is the perfect opportunity for them to reach out to us, and we can help them and guide them in regards to what might be the best health plan and cost for them. If you're older, reach out to us. I was having a conversation during that community health day last Friday with somebody that works with Medicare community, which is the health insurance for the elderly. But she was telling me that she works with a lot of people who come to them, and then they're asking, how do I help my grandchildren and my children get enrolled or have access to a health plan? So we exchange information, and we're going to be making sure that we're teaming up with that person and that organization, because not just because they focus on the elderly population, it doesn't mean that they cannot benefit from having this kind of information about Be Well NM, the health insurance marketplace. So we are here to serve you, to help you. Make sure you reach out to us, whether directly bewellnm.com or here to Ernie and myself at the Hispanic Chamber. And we'll be, like, if you are interested in hosting a webinar or a Zoom meeting, we also can be available to help you co-host that information session. More than happy to put you and your organization on the schedule. So anything else as we're wrapping up, Jeffrey, Maureen, or Ernie?
I think my comment brief, just thank you for this opportunity today. I'm sure many of you know somebody who has these questions, so just have them reach out, and thank you. And most importantly, we here at Be Well NM are incredibly privileged to offer this and to be of service to New Mexico. But just to remember that we exist to serve New Mexico. So if there's something that we can do to help through any of these questions or concerns, or even just get you connected to somebody that may not be ours, just reach out. That's our goal here. So thank you, everybody, and hope you have a good March.
Thank you. And Jeffrey said it well. I won't go into any more comments around it. Well said. And just reach out, and we are here for New Mexicans to serve.
Okay, so just as a recap, there's free assistance, free of charge to the consumer. There's financial help. Let's take advantage of that for those who don't have it. And we are here to help you. Anything else in wrap up, Ernie?
I just think exactly what Jeffrey was saying. Take advantage, look around. It may not work for you, but it could work for you. And this is a unique opportunity. And if you know people, please share this information with them. It's pretty easy, bewellnm.com. Just tell them to get on the website. They'll get instant help. So close.
Well,
So,
thank you, everyone. Thank you, Kathy.
I have to ask a quick question, though. This is the question everyone has sent in. Ernie, did you take the fall and injure yourself as part of the upcoming marketing campaign? Is this your ability to do like a personal testimonial to really bring that campaign home?
I think as part of being part of the team, I took one for the team, and I volunteered to do this, and I decided to do a rotator cuff because it's really not very painful.
Yeah, it's an easy injury to get back from. So, well, I want to thank you all. You did answer all the questions. I think one thing I just wanted to clarify, pre-existing conditions do not exempt you from coverage. Is that correct? And then, okay. And then if you enroll now, you get coverage in the next month. So if you enroll this week, did I hear correctly that you would be covered starting April 1st?
April 1st, that Thursday. And if you sign up even on April 29th, don't put it off until the very end. But if you do sign up by the end of the month, you will have coverage the next month. So the part of the reason we're encouraging people to get in sooner, though, is so you can get your cards and all of that stuff first in time.
All right. Well, hopefully people will be reaching out to you. I think this is an important message. We're grateful to have you, and we'll have you back on the 16th for one more round, if that's okay with you, just to give you another reminder on the 16th.
Thank you.
Thank you,
Great.
Kathy.
Wonderful.
Thank you.
Thank you. Goodbye, everyone.
Bye, everybody.
Thanks, guys. So hopefully you got all your insurance questions answered with that informative session. And next up is a session that I'm really excited about. I have to admit, prior to probably a week ago, I did not know that our next organization even existed. And I haven't learned much about them in the meantime, but I'm excited that we have a presenter today who is going to talk to us about the New Mexico Cannabis Chamber of Commerce. And that is Ben Lewinger. He's going to be joining us in just a minute to talk about the Cannabis Chamber and the work that they're doing. And so I am looking forward, like the rest of you, to learning as we go here. And so, Ben, I will turn it over to you. I will watch the chat room for questions, and I will let you talk to people about the New Mexico Cannabis Chamber and what you're doing.
Great. Thanks, Kathy. Appreciate you saving the best presentation for last.
Absolutely.
Really, very excited to be here. Thank you. Let's talk about cannabis. Let me open my screen up here. Okay, I'm sorry, give me 1 second. Okay, hopefully everybody can see my screen and not my notes. My name is Ben Lewinger. I'm the Executive Director of the New Mexico Cannabis Chamber of Commerce. We are an organization that's been in existence for about 2.5 years. This is the third iteration of some kind of cannabis association in New Mexico. The previous two were focused on the medical industry, which is where we are squarely focused now, because that's all that exists in terms of legalized cannabis in New Mexico. But we are very involved with the push for adult use, which is the correct way to say recreational cannabis. So what I'd like to do today is to briefly discuss the history of cannabis in New Mexico, talk about what's happened the last few years, talk about what we can expect for the remaining, 17 or 18 days left of the legislative session, and then talk a little bit about the chamber priorities. So if you are a chamber member, you may have seen part of this presentation before. If you're not a chamber member, give me a call. I'd love to talk more. This is an industry that is going to quickly open up for a variety of different businesses across the state, not just those directly in the cannabis industry. So I would be, really excited and honored to tell you more about the chamber, and you can join us on this magical adventure that has been the shift to adult use. So here's the obligatory About Us slide. The Chamber is the unifying voice of the cannabis industry in New Mexico. Our members include producers, manufacturers, a growing number of cannabis adjacent businesses like attorneys and CPA firms and gross supply stores and healthcare providers, architects. So again, we're a big tent organization, and there's plenty of room for everybody. Since I've taken over a year and a half ago, my focus has been on bringing the cannabis industry from raft to shore in terms of responsible legalization for people over 21. So this is our website, nmcannabischamber.org. Please visit the website, and if you click on this Join Us tab right here, you can join our email list and be kept in the loop. And I'll just say I've worked for and with several chambers of commerce. If there ever was the need for a unifying voice in any industry in New Mexico at any time period, it's the cannabis industry right now. And again, just really honored to be part of this really important industry as it takes this huge leap into adult use. So a brief history. I think this is an important place to start. The Controlled Substances Act of 1970. This was a key part of President Nixon's agenda, and this is really the foundation of the war on drugs. It placed cannabis as a Schedule I substance, which is the most restricted level. It means it has no medical value whatsoever. The same level as heroin, the same as psilocybin or magic mushrooms, which, interestingly, we are learning also has some powerful medical benefits. But I would argue that cannabis should have never been included as a Schedule I substance. And it's important to mention this and to start here because I think there's this perception that cannabis has always been illegal. And it's really, in the grand scheme of things, a fairly recent move, just 50 years ago with the start of the Controlled Substances Act, that cannabis was made illegal. And you've probably heard, if you followed the issue, that this was definitely motivated, at least in part, so that there was a tool to vilify and arrest particularly Black leaders, anti-war leaders. And as a result, this is still very much of the conversation today of how we can legalize cannabis in a way that starts to undo some of the harm from the war on drugs, which has disproportionately affected people of color. And, a huge part of the conversation is in New Mexico, as we are a state that looks now what the rest of the country is going to look like in 50 years in terms of our diversity. So this is why that restorative justice component and the drug law reform component is so important, but you'll see that it's really difficult to do right. And it's really difficult to undo what's happened the last 50 years. And then getting specifically into New Mexico. New Mexico is actually the first state that had medical marijuana legal. Something that not a lot of people know, but this is, I think this is an article from the Tribune, if you remember that newspaper, and it's Lynn Pearson and then Representative Manny Aragon on the left, who is the chair of Senate Judiciary. So Lynn Pearson is half the namesake of our current medical cannabis legalization, the Lynn and Aaron Compassionate Use Act. So in 1978, starting with 250 cancer patients for 12 years, 1978 or 8 years, 1978 to 1986, there were 250 cancer patients who were permitted to use cannabis to treat their symptoms. Just to be clear, cannabis does not cure anything. It does a darn good job of treating symptoms for a variety of disorders, including cancer, including seizure disorder, including autoimmune issues. But anybody who tells you that cannabis is going to cure anything, you should be a little suspect of that conversation. But in terms of being very helpful with treating symptoms related to pain, relating to PTSD, it works better in lots of cases than prescription drugs, and obviously way fewer side effects. So I would say for most people, unless you're a skeevy teenager, cannabis is medicine, even in adult use, even in a recreational market. I would argue that it belongs in a different category from alcohol and from tobacco. And people self-medicate with alcohol, but I feel like it's different. Cannabis has proven medical benefits, and the same person could use cannabis for insomnia one day, for stress another day, for PTSD the third day, for pain management the following week. So, keep in mind, from my point of view, every use of cannabis is medical, whether you're self-medicating or whether you're part of the medical cannabis program, which now has over 100,000 enrollees in New Mexico. Moving on in the brief history. Oh, everybody remembers this guy, Governor Gary Johnson, Gare Bear, as he's lovingly referred to in my family. So Governor Gary Johnson was the first big name politician to endorse adult use cannabis. And this was in 1999. And you'll hear me say adult use instead of recreational. And I would encourage all of you to adopt the same vernacular again, because it's not necessarily recreational in the same way tobacco or alcohol is, but it's, intended for use by adults and adults only, unless you're using it for a medical benefit. So despite getting a lot of grief, Governor Johnson was the highest ranking elected official to formally take this stance that cannabis should be legal. And for this reason, he will always be in our hearts and minds, even if he doesn't remember exactly where Aleppo is. And then fast forward another 8 years. This is Aaron Armstrong, the other namesake of the Lynn and Aaron Compassionate Use Act. So in 2007, Governor Richardson signed the Lynn and Aaron Compassionate Use Act. Lynn was the first person from the original the original cancer medical cannabis program in the 70s. So these two people are the namesake of the legislation that brought about medical cannabis as it exists now in New Mexico. Aaron Armstrong is a survivor of late stage thyroid cancer. She's the daughter of Representative Debbie Armstrong, who's been very vocal and a real champion for medical cannabis. Erin is still with us. She's an attorney at the ACLU, and she has also been a champion of improving the medical program. So you can see from 1970 to 2007, when we issued the first 6 licenses for the medical cannabis program, how quickly the top of mind perception of cannabis has shifted in our country. And then of course we have the federal movement, and we talked about what happened 50 years ago. I'd like to talk about what's happening right now. President Biden is not going to be the one to federally legalize cannabis. During his campaign, he said that he would decriminalize it. I think he will definitely remove it from the list of Schedule I drugs, but he is not going to be the guy who makes it federally legal. I would bet $10 with any 10 people on this call that the next Democratic president after President Biden will legalize cannabis in the United States. It's been legal in Canada for some time. It's going to be legal in Mexico soon. So in the same way that New Mexico has a state, all of our neighbors have legalized cannabis, with the exception of Texas, but they're getting there. As a country, our neighbors to the north and to the south are much closer, or have already legalized cannabis, or are much closer than we are to legalizing it. So the things that are happening right now, there's 2 acts, the MORE Act and the SAFE Act. MORE is the Marijuana Opportunity Reinvestment and Expungement Act, it does exactly what I just mentioned. It deschedules cannabis, and it creates a funding mechanism for community reinvestment to begin to undo some of the harm from the racist war on drugs. And then the second piece is the Secure and Fair Enforcement Banking Act, which would essentially make it possible for banks to deal in green money. In New Mexico, I think there are now 3, 2 banks and a credit union that deal in cannabis funds. I will say, and you'll know this from talking to anybody in the industry, everything in cannabis is 20% more expensive and 25% more difficult to do. So banking incurs much higher fees for green accounts, which makes sense because there's a lot more risk involved, but it's not necessarily easy. And then there's also federal restrictions. There's an IRS tax code called 280E, which makes it impossible for cannabis businesses to write off any business expenses. So if you can imagine, for your business not being able to write off those business expenses, you can see how quickly being in the cannabis industry can be much more expensive and a whole lot tougher. So both of these bills have passed out of the House. The Safe Banking Act passed out of the House under the previous administration, and I believe the MORE Act passed out at the very beginning of the Biden administration. So I do expect these to pass out of the Senate eventually. I can't really tell when exactly that's going to happen, but I would say definitely under this administration and as early as sometime next year. And short of federally legalizing cannabis, these two things will dramatically change the business landscape for how businesses can be involved in the industry. So our current medical cannabis program, again, it's been around for more than 10 years. Right now, there are 30 licensed nonprofit producers, LNPPs for short. And the way that those license works is they're vertically integrated. So LNPPs can cultivate, they can retail, they can manufacture, they can be a courier, basically everything except for testing their own product. LNPPs are able to participate in the market. And then there are also 14 independent licensed manufacturers. So manufacturers take the raw material and they make it into edibles, they make it into different kinds of extracts. There's now water-soluble products, there's inhalers, there's suppositories, basically anything that a medical cannabis, an enrollee in the medical cannabis program would need to safely get their medicine. As of today, there are over 100,000 active patients, which is a pretty substantial increase. The medical cannabis program at the beginning of COVID was marked as an essential business, and I don't think anybody in the industry took that for granted for even a moment. So we've seen huge growth in the medical cannabis, in the number of patients and the number of cannabis sold throughout COVID. So there you can see an increase of 27% from the middle of 2019 to the middle of last year. There are over 7,000 personal production licenses. So this is an add-on. If you're enrolled in the medical cannabis program, you can add on a personal production license, which allows you to grow 11 plants for your own personal use. I will say there was a law that passed in 2019, though, that allowed patients to gift medicine to other patients. So there is a group of people who grow cannabis. I know that's one of the hot topics in the conversation about adult use, whether or not we should allow people to grow their own. I'll say that growing high quality cannabis is very difficult. And I don't know how many of these 7,700 people actually take advantage of their license, but I'll just tell you that it's not an easy thing to do. And I will mention that for recreational cannabis, the home grow provision is, it's kind of a sticking point, especially with law enforcement, I think with the executive. So that's one of the things that we'll talk about as one of the peculiarities of the current push to legalize. We had $92 million in sales the first 6 months of 2020. There was $130 million in all of 2019. So you can see that huge increase in sales that I've spoken about. So this is just for the medical cannabis program. For a fully fledged adult use, a matured adult use cannabis program where anybody over 21 could purchase cannabis. The estimates for that fully developed market are $600 million per year and 15,000 jobs, and not jobs just as bud tenders, but as scientists, as marketing professionals, as attorneys. So that would quickly make cannabis, not quickly, in 3 to 5 years would make cannabis the 15th largest industry in New Mexico. And this is Ellie. She's the executive director and CEO of Red Barn Growers in Santa Fe. I think one of the businesses that really cares about patients and really has a patient-forward approach to their business. So from recent polling, and polls are done nationally pretty often. In New Mexico, they're done pretty often. This one was done right before this legislative session started, and we're tracking an increase in New Mexico and nationally for voters who support legalizing cannabis. So here, I won't read it all off, but 72% of all voters support legalizing cannabis, ensuring that that tax revenue is reinvested back into communities. And, you know, a pretty big distinction between Democrats and Republicans. But nationally, last year, we crossed that 50% threshold for the number of Republican voters who support legalizing cannabis. So nationally, legalizing now has bipartisan support from both parties. 80% want licensing fees to be scaled based on the size of the business. From the Chamber's perspective, we did not recommend that any license fees be included in statute, but, you know, important for the state to understand that license fees should at no time be a revenue generation strategy. It should really be to pay for the administrative cost of running the program. 62% of all voters support allowing individuals with prior marijuana convictions to work in the industry. Kind of a no-brainer. If something that was illegal becomes legal, it's pretty hard to continue to criminalize people for doing that activity that was previously legal. And then you'll see all the bills have some kind of fund that is created to support low-income patients. Okay, legislative preview. So I've done a similar presentation 3 times now. So I crossed out January and February and adjusted the words because I can't believe we're already to March. But looking back at this presentation earlier today, everything that I said about what to expect in the future has turned out to be pretty close to accurate. So hopefully these bullet points for what to expect for the rest of the month are likewise accurate. Multiple legalization bills negotiated into a single bill. So on Saturday, all the cannabis bills, which there were 4 of them presented, had their first meeting in a Senate committee, and that was Senate Tax, Business, and Transportation. The 4 discussed, there was no votes, and Chairman Shendo and Senate Leader Worth asked for parties to come together to get to a single bill to be presented and voted upon next Saturday. So that's very much what we're in the thick of now, is figuring out how to take the best parts of all these bills, combine them into one bill, and get something hopefully through the next Senate committee into the governor's desk that is going to be the best of all the bills included. So these are still the big issues. These are still what we're working on right now. Unlimited plant count. So this is something that the Chamber feels very strongly with. This is at the top of my list because I think this is the biggest issue for the Chamber. The state has to have a mechanism to manage production. Unlimited plant count will have 2 negative effects. It will create monopolies where the cost to produce cannabis will be artificially driven so low into the ground that small and medium-sized growers will not be able to compete. We saw this in Pueblo, Colorado, where 95% of all the cannabis businesses went out of business because they just couldn't produce cannabis at the same cost point that the big producers could. So this is not what we want. It will create a situation where a few monopolies will quickly gain market share and will edge out the competition. So this is anti-competitive, and then it also will create surplus, which will drive cannabis into the illicit market. In California, in Oregon, in Washington, some of these states that were the first to legalize, the illicit market still outpaces the legal cannabis market. And part of that is there's a huge overproduction. You may remember the vaping crisis from 2019. Well, that was a result of legal cannabis that had no consumer base. There was too much cannabis legally produced. You can't sell it across state lines. And it's not like the order was to destroy it if you can't sell it. That's not what happened. And it all just dumped into the illicit market, went into products that were untested and dangerous. And this is where we got the vaping crisis. So as risky as it is to not have enough, we don't want, especially as the industry, we don't want to run out of adult use cannabis on the 3rd day of sales. But more dangerous would be to have too much cannabis. So the Chamber is supporting a position of having some kind of yearly or quarterly study, and that this is pretty easy to do with the software that's available, just to understand market trends, to maintain market equilibrium, and to make sure that we don't produce. And by the way, this is something the governor has weighed in on pretty heavily, and something that she supports too. So again, these are the 4 big things that we're discussing with the legislation now that hopefully will come forward with a favorable bill. Automatic expungement. Again, when something becomes legal, past offenses, people in prison now for nonviolent cannabis crimes, and people who are out of prison for committing cannabis crimes that would now be legal, all those crimes need to be removed from the people's records. Absolutely the right thing to do, 100% really difficult to do, impossible to do the way that it's spelled out with the current bills that call for this. So the district attorney, the attorney general, they've all indicated that because of limitations in our current computer system, people would have to physically come to the courthouse to have records expunged, to have their records expunged related to cannabis. So it's presenting a real problem. So this is one of those things that is absolutely the right thing to do, but presents a very clear and present obstacle to getting the bill passed. So my hope would be that this would be, it's too late this year, but this would be included in a separate piece of legislation, an opportunity for the Attorney General, the District Attorney, the Department of Public Safety, the Administrative Office of the Courts, all these different entities and agencies to get together to figure out the best way to do it. Employer protections, something really important for lots of people on this call. Employers need to be able to maintain a drug-free workplace, especially in New Mexico, where federal funding is often on the line. Sandia employees are not allowed to use cannabis, whether or not they have a medical cannabis card. So it's really important that employers maintain the ability until it's federally legal, and then we'll have to figure this out. But for now, that they maintain the ability to retain a drug-free workplace. And I know some of the other questions about, impairment on the job, those are the questions we're gonna have to work through. I'm the former executive director for Mothers Against Drunk Driving, and I will tell you that I don't see any future where there is a scientific way to test for cannabis impairment. So there's never going to be, I hope I'm wrong, but I don't think there's ever going to be anything like a breathalyzer, but for cannabis. There's no presumed threshold for cannabis. The amount that people can consume or smoke without being impaired it's so drastic compared to, it varies so drastically compared to alcohol that I just don't think that technology is going to be there. From a law enforcement perspective, there is a version of the standard field sobriety test that we already have law enforcement officers with this accreditation called the drug recognition expert. They can already do a version of the field sobriety test to test for impairment from other substances besides alcohol. So I'm not as concerned about that on the enforcement side, but I make no false presentation that this transition is going to be difficult to figure out how to manage impairment in the workplace. However, it's not too dissimilar from prescription medication now. So I would say, as a manager, whatever you do for somebody who shows up to work impaired from prescription medication, it's probably going to be the same approach you have now. And then tribal issues, which tribal issues really fall into 2 categories. The first one is cannabis activity on federal tribal lands is still technically illegal. Even for states that legalize cannabis on federal tribal lands, it's still illegal. There has been guidance from the Department of Justice that is, purposefully vague. It makes it clear that a U.S. attorney's job should not be to bust people for using cannabis on tribal lands. However, it doesn't specifically say that it's not going to do that either. And then the second issue is, how do we create equity? How do we make sure that the opportunities to enter and thrive in this industry exist for Native people and tribal entities as much as they exist for everybody else in New Mexico? This is from a recent article in the Albuquerque Journal. So these were the 4 bills presented at Senate TBT on Saturday. And these are the 4 bills that, in theory, if we're successful, are going to combine into a single bill. And I will say, for everything but 288, they're 95% the same, maybe even more. The bill that the chamber has endorsed is Senate Bill 13. And, our approach has been to take last year's bill, which got further than any other bill, and to really bear down to the minimum viable product that we need to responsibly pass a cannabis bill. I would say that the mistake that has been made in the past, and the mistake that is still being made with some of these bills, is that there's too much. There's too much in there that is contradictory. You're trying to do too much. There's just too much in there that doesn't belong in enabling legislation. So our approach has been to work with our sponsors, Representative Lujan and Senator Ivy Soto, to kind of get the minimum viable product to responsibly create the regulatory framework, to create a tax structure that makes sense to make cannabis legal, to ensure that there are equitable opportunities for people to enter into and be successful in the industry, and to protect the medical cannabis program, which is a priority for our governor. And frankly, it's a priority for the industry. We've served patients for 10 years, and we want to make sure that at no time patient supply or the options for patients have in terms of products and the different kind of cannabis that they get to Medicaid is ever at risk. So these are the bills. House Bill 12 passed out of the House. So that is passed out of the House floor. Not a huge surprise, because it passed out of the House floor last year. And then so it's included among these Senate bills. House Bill 12 is very close to Senate Bill C-363. Senate Bill 288 is Senator Cliff Pirtle's bill, which we'll talk about some of the personalities involved here. But again, 95% the same. Of course, the important part is always in the details. This is Representative Tara Lujan. She's the sponsor of House Bill 17, which was tabled in the House, but she presented the Senate version of that bill in the Senate committee on Tuesday. And her quote is very simple. "We simply cannot afford to wait another year. We need to grow and go for New Mexico." Arizona legalized last year, and they did it via ballot referenda, which is not something that we can do cleanly in New Mexico. And they've already had their first recreational sale. Colorado has, of course, been legal for some time. Texas has legislation introduced that I don't think will pass, but if Texas beats us to the punch, I'm going to have to move to Hawaii or something. That would be the most embarrassing and sad thing for our state. And then again, the country of Mexico is about to legalize. So this is the year to do it. The chamber's approach of having a bill that is short, simple, to the point, I sincerely hope that is reflected in whatever single bill is presented to TBT on Saturday. Senator Cliff Pirtle, oh, that's the wrong district. Don't pay attention to that. He's from down in Roswell. You may recognize him this year. He has a shaved face, looks like a baby. In previous years, he's had a full beard that goes down near his belly button. I would encourage him to grow that back as quickly as possible. His concern is we don't want to put a tax rate so high that we tax legal cannabis out of the market. So based on the information from the governor's working group in 2019, that 20% tax rate is kind of that magic number where it's not going to drive people to the illicit market, where cannabis, of course, isn't subject to any tax. So all of the bills, and I've spoken with Senator Pirtle, his preference would be to even get that down a little bit lower to 17 or 18%. But all of the bills, although they handle the tax structure differently, you'll see that all of them are kind of narrowed in on that 20% tax rate. I will say for Representative Lujan's tax rate, it was the most, I think, common sense approach, and one of the reasons the chamber sponsored the bill. It removed GRT from medical and from adult use cannabis and just put a single 20% sales tax on adult use cannabis. So whether you're in Wagon Mound, whether you're in Santa Fe, it's not subject to GRT. It's the same tax rate wherever you are in New Mexico, with 13% going directly to the state and 7% going directly to county and municipal. Really empowering those communities to use that new revenue how they see fit. And then Representative Javier Martinez, he is probably the most out front legislator working on cannabis. Again, his House Bill 12, he was the sponsor of the same bill last year. It went through committee last year. It went through committee again this year. The vote was a little bit closer this year with several Democrats, I think five or six Democrats switching sides and voting to not pass House Bill 12. But if you're watching one bill, I think this is the one to be amended that could go the distance. And then Senator Jacob Candelaria, he has essentially the same bill on the Senate side. And those are the two that are most obvious to combine. And for Senator Jacob Candelaria, who is a medical cannabis patient, he, is very proud of that. He's been working on the issue for some time. He's an attorney. He's defended cannabis patients for, job issues. Suffice it to say, this is something that's very close to his heart. For him, he thinks there should be no cap on plants or licenses for producers. So that is that single point of contention from a chamber perspective is the state has to maintain an ability to responsibly manage production. And Senator Candelaria is on the other side saying, a free market is what is needed. It will regulate itself. Not the case in Oregon, where they had to go back last year and introduce legislation to create that very mechanism, because I mentioned the vaping crisis. So, we'll see what happens, but this is the biggest thing to discuss. And one of the really cool and interesting and wonderful things about our legislature is they're all volunteers. It's the last volunteer legislature in the country. So I would be remiss if I didn't mention that Senator Jacob Candelaria, as well as Speaker Egoff, are both attorneys for the top producer in New Mexico, who is this slide. So just keep that in mind, that it is possible in New Mexico for legislators to work for clients who are, very vested in the legislation that they're working on. And that character is Duke Rodriguez. He's the CEO of Ultra Health, which is the biggest LNPP in New Mexico. He is an Arizona resident, but he is from New Mexico politics. I think he did he managed some healthcare startups or healthcare businesses in Wall Street back in the day. Came back, and I believe he was the Department of Health secretary under Gary Johnson. So he understands the legislature. He is looking very far ahead into the future when cannabis can cross state lines, and from this quote, even country lines. Full disclosure, Mr. Rodriguez is not a member of the Chamber of Commerce. I wouldn't even say we're frenemies. We talk on the phone a lot, but there are some interests in terms of legalization that don't necessarily align. And then Emily Kaltenbach from the Drug Policy Alliance. She has probably been the biggest voice in New Mexico in terms of that restorative justice piece, in terms of that, how do we undo the harms from the war on drugs? How do we create equity for people in the industry? So she has been a long, consistent voice in the legislature, talking about how this bill isn't about revenue, although it will make revenue. This bill isn't about creating a new industry, although it will create a new industry. It's about how can we make sure that we do it correctly so there is reinvestment into the community. And then finally, the biggest policymaker, not finally, there's one more after this, but our governor, Governor Michelle Lujan Grisham. In 2019 and going into the legislative session last year, the governor made a big push, advertising that she wanted New Mexico's adult use program to be the envy of every other state. In 2019, she formed a working group that met regularly for 3 months, a huge investment in time and resources. This working group went to other states, met with law enforcement. We set up several tours of grow and manufacturing and retail operations. So legislators and working group members could see what we were talking about. And this is what, this was the starting point for legislation last year. The bill last year was over 200 pages. House Bill 12, which again seems to be the bill with the most traction, is nearly 200 pages. And it's regrettable that the chamber's approach of really just trying to enable cannabis sales for people over 21. Our bill was just over 100 pages. It was very simple, regulatory framework and tax structure, and that was it. So we'll see what happens. But the governor this is a huge issue for her. She was absolutely vital in the medical cannabis program. The medical cannabis program is her baby. She wants to protect patients, but this was a campaign promise. So this is something that's very important to her, passing adult use cannabis, but also doing it right. And then we have Senator Joe Cervantes. He is the chairperson of Senate Judiciary, which is where the bill stalled out last year. His commitment has been, if the same bill comes to my committee, it's not going to pass. And the commitment from some of the other policymakers pushing adult use has been, this is the same bill, this is the right bill, this is the bill that's going to make it to the governor's desk. So after we get through the Tax, Business, and Transportation Committee, Senate Judiciary is the next step. And that still is an obstacle. The composure of the Senate has changed a little bit. Some of the other moderate Dems were primaried. But I think Senator Cervantes is going to have a lot of insight and a lot of input on what should happen with this legislation in his committee. Again, why it's so important to make sure that the best version makes it there. So these have been the chamber's priorities that we have been espousing, and I've been spreading the good news to anybody who will listen. And this is what you'll see were the priorities in House Bill 17 and Senate Bill 13, and still our priorities in the discussions now as we negotiate to a single bill. Create a regulatory framework and tax structure that makes sense for New Mexico. So something that curtails the illicit market, something that brings revenue to the state without exorbitant licensing fees. Right now for a medical cannabis license, it's $180,000 a year, which is too much. And you'll see that all of the bills include some form of micro licensure. And this is really that avenue, that pathway for mom and pop businesses to enter into the industry and either continue to operate with that micro license, kind of similar to a microbrew, or use that as a stepping stone to get to full licensure. New Mexico is a very poor state. It's not a state that's heavily resourced, and it's really important that we create opportunities for New Mexicans. So we're walking that fine line of really trying to figure out how outside investment can come into the state without taking over the state, right? There's hugely resourced Canadian companies and California companies that are eyeing New Mexico to buy up licenses and quickly invest enough in their businesses to take over market share. And that's what we're trying to avoid. Learn from mistakes in other states, learn from mistakes and successes with our own medical cannabis program as well. And then, make sure that our framework is ready to adapt, not only with the easing of federal restrictions, but with cannabis being federally legal. Again, that $10 bet is still on the table. The next Democratic president will make cannabis federally legal. Creating those equitable industries, or the equitable opportunities. So our plan, and the plan with really all the bills, is to build on the existing strong foundation of the medical cannabis industry while creating as many of these pathways for micro licensure as we can. And doing all of that before there's huge investment or huge opportunities from out of state or out of country companies that are much better funded to come in and set up shop in New Mexico. Really lean into these programs that we have right now to assist businesses to get started. JTIP is one program that has been very successful in the medical cannabis industry, creating jobs in manufacturing and also in cultivation. We want to make the licensing flexible and affordable. Again, $180,000 a year for a license as it is in the medical program is too much. And finally, we need to pass a bill. We need to pass the dang bill, the single most important action from a restorative justice perspective, from a financial, economic perspective, from a beating Texas perspective, is to legalize adult use cannabis right now this year. And of course, we want to protect the medical cannabis patients, the medical cannabis program. This means ensuring that there is always patient supply. So you stop selling for adults over 21 who aren't patients before you run out of cannabis, because you have to protect that medicine. Cancer patients, if you really want to see who some of the patients are, I would invite you to sit in on a DOH rulemaking hearing related to the medical cannabis program. I can't tell you how many children in particular who suffer from seizure disorder, and this is the only medicine that can help them and still make it possible for them to participate in school and be kids. And protecting the medical population and the medical program is very important. And then, of course, weakening the illicit market. We cannot be like California, where the illicit market continues to outpace the legal market. We have to make sure that we do everything we can if we're going to legalize cannabis, we have to make sure that we legalize it. We have to make sure that we do it right. And we have to make sure that it's cheap enough and that the tax structure is right so people don't continue to purchase from the illicit market. I think that's it. I feel like I spoke really fast, but it looks like for a solid 40 minutes. So there's our contact information. There's my email address. I would love it if you would reach out and join us on this adventure. Join our mailing list, and we share everything going on in the legislature. And selfishly, I just want to get through this so we can get to the good business of what an association should really be doing, which is focusing on supporting the industry and supporting our members to be the most successful. So I believe I stopped sharing. There's Kathy. Thank you.
So do you have time for questions?
Hit me. All the questions. I'm ready.
And I apologize. I have a phone ringing in the background. I can't get to it. So I apologize for that temporary distraction. So I guess one of the big questions is, and again, speaking on behalf of the hospitality industry, it's been interesting to see that the business owners have started to have a little bit of a shift in their attitude towards legalizing cannabis. But there are still a lot of concerns about impact on the workplace. So as somebody who's really thoroughly researched this, speaking to someone who has not thoroughly researched this issue, what are some of the best resources that businesses could access to sort of educate themselves about what legalized cannabis would do is in terms of impacting their business, especially like on our side of the business, there are transportation companies, tour guide operators, people that have mechanical equipment issues. Where can they go to research that?
So, again, that clause, making sure that employers can maintain drug-free workplaces is really important, but at the same time, it's just a stopgap. Federal legalization is coming, and we're going to have to, the larger business community is going to have to figure out how to deal with this from a liability perspective, and just from a perspective of not preventing our employees from doing something that's legal that they want to do. So I guess what I would say is all of your employees are already using cannabis. All of your employees are using prescription drugs. Legalizing it shouldn't change the difference. It shouldn't change anything from a day-to-day. If somebody shows up to the workplace impaired, you have the same recourse that you would have if they showed up intoxicated on alcohol, or if they showed up, intoxicated on any other drug. So I don't think there's going to be a huge difference with legalized cannabis. There might be a little blip initially for the first few months, and then I think the novelty will wear off, and that's kind of what we saw from Colorado. I will say that treating it as a problem that we can just kick the can down the road and continue to ignore is not going to work, because someday it will be federally legal and you won't be able to prevent somebody from using cannabis. And that's not to say you won't be able to prevent them from being high on the job, but there will be a day where, as a manager at Sandia National Labs, you drug test and somebody tests positive for cannabis, and as long as they're not impaired, you have no recourse. So that was very kind of you to say that I was somebody who had researched the issue and knew what the answer was. I don't. Okay. That's a big part of the conversation, and I will say that's going to be the focus for our programming, the Cannabis Chambers programming for the next, definitely this year, is really figuring out what those details are and what that's going to be for employers who, not only in New Mexico, but who want to work anywhere in the country, because that's the future that we have coming.
Yeah, I think just again, from talking to some of our members and business owners around the state, if there was some way to put some kind of communication vehicle together so they could talk to business owners, maybe in Colorado or in Oregon, and see, what's it like? Because, we're not going to be the first in this arena. And I guess that leads to my next question, which is, what are some of the big things that we as a state can learn? You already mentioned that Oregon had to backtrack, I think, when it related to production caps. So what are some of the things that we have learned from Colorado going before us, Oregon going before us, that will help New Mexico do it better?
I think that is the single biggest thing that you mentioned, is making sure that the state has some way to manage production, whether it be through how they open up RFPs for new licenses, or how they manage the actual production for each license, which in New Mexico it's done through plant count. I think some of the other more developed markets do it through canopy. So they look at the square footage instead of just the single plant, because you could have, you could have a cannabis plant that's 2 feet tall, or you could have a cannabis tree that's 20 feet tall, and they will produce different amounts of cannabis. So plant count probably isn't the best way to do that. And I would hope that in rulemaking, we look at better ways like canopy to help manage production. I think not necessarily from a business standpoint, but there's been a lot of discussion around the substance impaired driving issue. And I think a lot of fear mongering. And from my perspective, there has not been a huge increase, except for, again, that initial blip in Colorado shortly after it was legalized. We haven't seen a huge increase in substance impaired driving for only cannabis. There are people who are already drunk who may also have cannabis in their system, but I don't think that we have a lot to fear in terms of substance impaired driving. The caveat of that is that some of the bills that are coming before the legislature allow for consumption lounges, which are things that are very popular in California, where you can go and order a $25 sandwich and a joint with it, and you actually consume the cannabis out in public. It's like a bar for cannabis. I think not only do, by and large, the membership of the Cannabis Chamber of Commerce, they have no interest in doing that, mostly from a liability perspective, but I would say that that is the single place where, again, I'm the former executive director of Mothers Against Drunk Driving. I've been on the DWI Planning Council for Bernalillo County for 8 years. I would see consumption lounges potentially being a threat in terms of substance impaired driving. Otherwise, from a business perspective, I think there's that 11,000 job number that I mentioned. I actually think that is pretty conservative. I think the way that all these cannabis adjacent businesses are going to need to come together and find opportunities to support and grow with the industry is probably, the most exciting part of New Mexico. We know who the producers are going to be. Even if they're not already here, we know who in Colorado or in Canada is interested in setting up shop in New Mexico. What we don't know is those cannabis adjacent businesses, those marketers or those architecture firms, all these different businesses that see the opportunity in really kind of going all out into the cannabis industry. And it's, working with our members, I will say in the past, it's taken a special kind of person to be in the cannabis industry. I think there's a combination of assertiveness, a combination of risk tolerance for, doing something that's still federally illegal. And I think those same qualities in other businesses are going to create opportunities for businesses not directly in the cannabis business to quickly make that a huge part of their business. And, we saw that with banking. There was one bank in New Mexico that was the first to open cannabis accounts, and they did very well because they managed that risk and were able to, bring all these businesses on board. So I think that's nothing but opportunity.
Okay. And then one other issue that came up again in conversations I had with some of our members is the fact that I think people are becoming more aware of the social justice aspect of this issue, which I think was hidden for a long time, but it's something that resonates on across party lines, across businesses, no matter what area of the state you're in, that social justice component is important. So is there a good resource or good research out there that people can access easily to learn about the social justice impact of changing the focus of these laws?
Yeah, so I had a slide with Emily Kaltenbach from the Drug Policy Alliance, and the Drug Policy Alliance is a national leader in figuring out how to, full disclosure, their position is to decriminalize all drugs. So cannabis is their focus in New Mexico, but they are really on the forefront. They're the national thought leader in how to undo the harm from the war on drugs.
Great. So again, because we're a big part of our audience is business people that are out there looking for how they can, make an impact one way or another during the last few weeks of the legislative session. How is getting in touch with you the best way to get information, to share their opinions with legislators? What's the best way for them to do that?
Sure. Yeah. And, the message is pretty simple. All of legislators, it's the fight is going to be in the Senate. And if you are friendly with a senator, I would reach out and say, these are the two most important things. The state has to retain a mechanism to manage production. And the state should allow cannabis industry to have voice in the policy advisory committee that's going to be involved in the rulemaking. So definitely feel free to reach out to me. Just Google NM Cannabis Chamber. My email and phone number is on the website. But also, this is an issue that's bigger than the Cannabis Chamber, so don't feel like you have to go through me. But I would reiterate that production management piece is the single most important thing that has to be included in any piece of legislation. And if people feel empowered to reach out to their elected officials and let them know that, I would very much appreciate it.
Okay. All right. Any last thoughts you want to get out there other than the production piece and
No, I hope everybody's excited. It's going to be big for New Mexico. It's no longer a matter of if, but a matter of how and when. And we just have to beat Texas to the punch. I guess that's the message. We lost to Arizona. We cannot lose to Texas. So come on, people, let's do this.
That'll get people going. If nothing else, just bring up Texas. That'll get them revved up. All right. Well, thank you so much, Ben. I appreciate you giving us some time today and sort of helping educate us on this important issue and especially to help business owners, make informed decisions and about how to advocate for their own businesses. So thank you very much. Thank you to all of you today for joining us for today's virtual Roundhouse. We have 2 more virtual Roundhouse sessions coming up before the end of the session. So I encourage you to tune in next Tuesday and then Tuesday, March 16th. March 16th is going to be a big day for us. We're going to have sort of a recap of some of the key issues. So we touched base back with some of the cabinet secretaries that we heard from, with some of the legislators, and with some of the presenters about issues around mental health, cannabis, access to health care, food policy issues around the state. So again, touch base with us next Tuesday, and then again on Tuesday the 16th. As always, I want to say thank you to Katie from the Santa Fe Chamber, who keeps this platform running so smoothly every session. Thank you to the Santa Fe Chamber in general as a co-host of this event, and of course to the New Mexico Chamber of Commerce for also being a co-host of this event. For our presenters today, thank you for giving us the gift of your time and sharing your expertise, and again, helping us all learn about the important issues that are taking place during this legislative session. And as always, thank you to PNM for hosting this platform during the virtual Roundhouse, so that we have this main stage available to review and discuss and talk about important issues. So again, thank you for joining us today. I encourage you to come back and see us next week on the 9th, and then again for our wrap-up session on the 16th. Have a great day, and don't forget to keep track of what's happening in your legislature and advocate for yourself and for your business. Thank you all. Bye-bye.